Hi, I'm with Chris Giles from Epic Pharmacy in Queensland. And Chris has got contributing to a couple of posters, but he's going to talk to us about one that he's got presented. Do you know what number it is?
163.
163, there you go. And it's about opioid use and prescribing, and they've got a huge amount of data that they've discovered, and tell us about what it tells us.
So we've decided to look at our usage across all of our hospitals for the last nearly 12 years and have a look at specifically what's being prescribed in the hospitals. There's data out there showing what's happening across the broader community with PBS prescription data, but we've decided to look at whether that subset of patients within the hospitals reflects the trends we're seeing in the community. We're particularly interested in seeing whether drugs such as oxycodone, which have got a lot of attention lately for potential misuse and diversion, is whether the hospital prescribing for that may potentially be contributing to the pool of drug that's in the community that may not be used in the manner that it's intended. So with the data that we looked at, we took nearly a bit over 9 million patients, 9 million prescriptions, 1.4 million patients, and basically picked out the opioid analgesics that are prescription only that are likely to be ambulatory patients taking when they go home. And with that data, we took their defined daily dosage from World Health Organisation and expressed it per 1,000 patients, and looked at also the proportion of opioid scripts to total prescriptions being prescribed within our patient pool. And what we found was there was a significant increase in opioid prescribing over that 12-year period, increased about sixfold in terms of the total number of scripts. And we also found that, in particular, amongst all of the opioids, the oxycodone usage has increased quite dramatically. There were some other increases in some of the other chronic pain analgesics, such as hydromorphone and buprenorphine, particularly when they had their indications extended out to non-malignant pain. But in particular, we looked at oxycodone in the 5 milligram immediate release category as well to see sort of how much usage was going on there, and it was a very strong linear trend increasing with that drug. There's been some concerns expressed around the amount of analgesics leaving the hospital with patients. Some of the data suggests that it's the drugs that are being diverted does come from not so much the chronic pain patients, but from more the acute pain. It also tends to be family members and friends that are the source for these. So some of these leftovers that come out of hospital after discharge may be ending up with other people. So that's basically some of the data we're looking at. So with all the data, what are some of the things that you expect to see that is used with it? Well, at this stage, it's quite sort of macro level data at the moment. Over that 12-year period, some of our hospitals changed. So regardless of that, the oxycodone use has increased. What we don't know from the data that we've got is specifically around how much of what's being prescribed and supplied is actually being used by the patients. So the next step will actually probably be some studies involving looking at post-discharge interviews with patients, that sort of thing, and just to get an actual idea for certain sorts of procedures, how much of the prescribed medications are being used, and then hopefully provide prescriber feedback in terms of looking to maybe reduce down to a more appropriate quantity what's being sent home. So.
Yeah, there's certainly a lot of concern for opioid use in the public and with legislation, so helpful data.
Yes.
While you're here at the conference, what are you looking forward to seeing?
I guess I like to see sort of what other sites are doing, get a bit of motivation and inspiration for ourselves within our organisation. Seeing people from other sites that I haven't seen in a while, it's always a good social event as well. So, yeah.
Old friends?
Yep.
And the gala, of course.
Yes. Yeah, that should be a lot of fun.
Yep, terrific.
Yep, always good.
Well, thanks for talking with us today.
No worries.
And enjoy the rest of the program.
Great, thanks.
Thanks.
Cheers.